Cough, COUGH, is a reflex which is common amongst children as well as adults. If a child starts coughing on exposure to dry cold, suddenly, accompanied by sneezing or not, sometimes fever, use Aconite 30, ACONITE 30. It's a very effective remedy. In case the child's face turns red, hot, its eyes stare, the cough is violent, its onset is sudden, the tonsils could be inflamed, red, glistening, hard, and painful. Sometimes you can see the cough is very violent. Give belladonna 30, BELLADONNA 30. If there is cold in the chest, there would be painful coughing coming out from the center of the ribs. You can watch it. The child thirsts for cold drinks. We give bryonia, BRYONIA 30. When there is a rattling accumulation of mucus in lungs, which is difficult to take out, antimony tart 200 comes in. Greatly effective remedy, never fails. If the cough takes the form of wheezing, oppressive respiration, nausea, vomiting accompanying, use Ipecac 30, IPECAC 30. If the coughing spasm strangles the child, the mucus is yellow and thick, there could be pus in the tonsils, shooting, piercing pain. Cough can be loose, rattling and croupy. There is pain on empty swallowing. Heper self 30 should be given. In case a thick, ropey, green mucus flows inwards, it's difficult to take out and clear the throat. The cough is brassy, it is hacking, it's like an old canister being beaten. In cases of old colds, chronic sinusitis, give Calibicrome 30. For simple dry cough, when the larynx is sore, Nux vomica 30 comes in. For loose cough, yellow-green mucus coming out easily, old colds, mark my words, old colds, give Pulsatilla 30. There is another cough which is called Croup, CROUP. It is an inflammation of the larynx characterized by respiratory difficulty and a hoarse, brassy cough. Its onset is sudden, usually during night, frequent spasms. Child awakens with a dry, barking, ringing cough. Ho, ho, ho. There is difficulty in breathing because of congestion and swelling of the lining of the larynx. There is crowing respiration, like a crow. Voice is hoarse or lost. Skin is hot and dry. If the face and lips turn blue, contact a doctor immediately. Meanwhile, keep the room humid and warm. Give steam inhalation. First of all, give Aconite 30 every 15 minutes under till the coughing is under control. If the lungs are choked with phlegm, there is a rattling sound. The child cannot take out the phlegm. Nausea is present. Please give Entim Tart 200. If the cough is loose and metallic, the fever has subsided. There is rattling in chest, difficult expectoration. Hepar Sulf 30 helps. During convalescence from Croup, give sulfur 30 once a day early morning for 7 days. Now we take up a very frequent symptom of a child's unhappiness. The child is crying. Normally a child is a bundle of joy. Some of the images I have given in this video prove it. But when it cries, it is a matter of concern for the parent. The cry of a baby is a signal to indicate that it is in distress. A child cry is expressive and varies in character. A normal baby signals hunger, anger, pain, loneliness or discomfort through a cry. Cries of loneliness stop when the baby has company. Mind you, a baby is lonely. The moment it gets company, it stops crying. And we somehow do not think of a baby's thirst. Hot weather or peevishness lead to more thirst. Give the baby a sip of water. When the baby is tired, it moans softly. Put it to sleep with a lullaby. A hungry baby cries as a matter of right. A mother normally never lets this happen. She has her breast ready or food ready depending upon the age of the baby. Still, it is good to think of this possibility and feed the child. A sudden shriek indicates that the baby has wet its nappies. Change the wet nappy. Nothing else is to be done. The colic cry can be guessed by the baby drawing up legs, passing wind, showing restlessness. It is a sudden cry that alternates with relaxation. In case the pain is severe, unbearable, the baby cries severely. You can't comfort it easily. When there is no apparent cause, investigate the person of the baby for symptoms of sickness like a skin bite, earache, stuffed nose, or blue skin caused by an injury or otherwise. The infant should be fully undressed in a warm, comfortable room and looked at. Note the form and movement of its chest and abdomen. See whether its skin is hot, cool, moist or dry. Look for eruptions as well. If the baby is very sick, is losing color, draws up legs, call a doctor. However, start with Aconite 30 if there is sudden fever, sudden cold, on exposure to dry cold air, restlessness, anguish. If an insect bite occurs, there is swelling for any reason, swollen red patches, give Apis 30, APIS 30. For injury, bleeding due to injury, or when the child is tired, use Arnica 30, ARNICA. If the baby's head is hot, the eyes are glistening, his face is flushed. Red predominates, remember, red predominates. The tonsils are red, the eyes are red or anything red. The tonsils are swollen. Give Belladonna 200. If the child touches the ear that is aching, if there is dry hacking cough coming from the chest, if the child has constipation, dry burnt stool, use Bryonia, BRYONIA 200. If the child cries when passing urine, it is feverish, Cantharis 30 helps. Cantharis. If the child is peevish, it wants to be carried all the time, or when it has dentition pain, or when it has colic, draws up legs, loose bowels, use chamomilla, CHAMOMILLA 30 and get immediate relief when a child cannot go to sleep. It rolls restlessly. Use Coffea 30, COFFEA 30. For severe colic, when the child bends over double, he presses the abdomen. When the least food intake results in jelly-like, fetid, dysenteric stool, give Colocynthias, COLOCYNTHIS 30. These are excellent remedies. They don't fail. Just listen to my video carefully and choose the medicine. You would be happy because the child will be happy very soon. Thank you very much. Thank you for listening to this video.